Hi there, my name is Dr. Katie Saint, and this presentation is about autism and depression in adulthood. So I'm going to share my screen so you can see the PowerPoint. Here we go. So autism and depression are connected. The symptoms overlap. So if somebody is struggling with depression, it might amplify some of the struggles with autism and vice versa. So it's important to understand the risks for both diagnoses so both symptoms can be treated appropriately. So in this presentation, we're going to talk through what those symptoms are and how to treat them. So looking at the facts about autism and adulthood, about 25% of adults are living independently if they have an autism diagnosis. To me, that's super sad because this is a population of people that are extremely capable, extremely intelligent, and there's research-based treatment that can help them live independently. So we need more people getting into treatment so that they can live independent, meaningful lives. So part of the reason for that lack of independence is there's a, a lack of people pushing them, holding them accountable to be independent. A big trait with autism is to stay in your comfort zone or routine. So sometimes because of that, there is a lack of motivation to move out and live independently. Sometimes it's financial reasons. Employment could be difficult, or there's maybe some SSI limits where if they make too much money, they lose their SSI. And so that's not a risk that they want to take. And so that can be an obstacle as well. Something else to consider is that many people with autism have other diagnoses too. And so that's a big piece of some of the obstacles that they're facing and that they need to work through and figure out how to manage. So, for example, a lot of people with autism have GI issues. According to this chart, it's about 60%. So that's pretty high. So, for example, we have this 20-something-year-old client who has pretty massive GI issues. This results in him using the bathroom a lot for long periods of time, and sometimes he even will poop his pants. And so that can hurt him socially, that can hurt him vocationally. So, learning how to manage these symptoms, going to the doctor and getting them treated medically is a big part of his treatment to help him get to the point where he can be independent, he can have those meaningful relationships and contribute with a job and all that kind of stuff. If we look at the mental health diagnoses on this chart, bipolar, ADHD, OCD, anxiety, depression, those things are really high. So that's something that we want to treat. Those are treatable disorders. And so we can make that not be an obstacle. So approximately 40% of adults with autism have depression. And when we look at IQs and intelligence, the higher the intelligence level, the higher the rate of depression. So this is a pretty depressing stat. There's treatment for this. Depression can be cured, and so that's part of why we want to get the word out. So let's look at the differences. Sometimes people miss that their loved one with autism is struggling with depression because some of the autistic symptoms can hide the depression symptoms. So, for example, it's really common for people with autism to struggle with communication, to limit themselves socially, to have rigid behavior, sleep issues, eating issues. It's super common. So when it's depression, though, what we're going to see is that there's a sudden change. So they used to come out of the room, be social with their family all the time, and suddenly that stopped. Or they used to sleep well and now they're not sleeping at all. So you're going to look for that change in routine for them, change in personality. So, difficulty making decisions is common with autism sometimes. But if that just suddenly started where they just don't have the confidence to make decisions anymore, that's where you're going to start to wonder if this is not an autism thing, but maybe a depression thing. So, common barriers that can lead to depression include quite a few factors, but what's cool about it is all of these factors are treatable. So, first one is relationship troubles due to missed social cues. So, this is really common where people with autism sometimes say things that hurt other people's feelings totally by accident, or they missed reading some nonverbal cues, and because of that, the situation went awkwardly, or they had trouble maintaining friendships because of missing these social cues and not understanding what's okay to say and what's not okay to say. So, this is a really big part of treatment that we work on with people with autism. The research shows that relationships is the number one thing that's going to prevent depression. So, this is such an important skill to work on. Next, incorrect application of directions. So, what we see sometimes is really literal interpretation of verbal communication. So, sometimes our clients, even though they're really intelligent, they are misunderstanding what we're asking them to do. And so then they do it wrong. And this gets them into trouble at work. This can prevent some independence sometimes. So, working on that comprehension, working on sarcasm and idioms, different things like that to help them understand following directions. So, rigid thinking or inflexible thinking sometimes is a barrier. Um, Part of the diagnostic criteria for autism is to love routines and really appreciate sameness. And so, because of that, sometimes people with autism can be a little rigid and not open to trying new things or different approach. So, a big part of treatment is to work on that flexibility and help them learn how to adapt and cope with the emotions that happen. Because what happens when they're not flexible is it limits their life. It causes stress for them, it causes conflict. And so we want to protect them from that pain and help them to be more flexible so life isn't so stressful. So, difficulty with generalization or applying new skills is a common factor that people struggle with that can lead to depression. Because of that routine based behavior and the insistent on sameness, sometimes generalizing skills is difficult. So we have to intentionally plan for that and train for that and go to different settings, involve different people to help with that flexibility. Another thing that's an issue is motivation sometimes. So, low self esteem or not wanting to get outside of your comfort zone. Sometimes they'd rather just live at home with their parents the rest of their life, not looking at that someday my parents are going to not be able to take care of me, or that's going to prevent me from having meaningful relationships, things like that. And so, part of treatment is helping them see like what is all connected. So we dive into their values, we dive in what do you care about? What would a good life look like for you? How are we going to achieve that? And really to help them see what kind of consequences they could be facing if they don't change some of their behavior, and how some of their choices right now lead to pain. They might not realize how some of their behaviors are actually causing them quite a bit of stress. So we try to talk through that and help gain an understanding to get them to a place where they're not causing their own pain. So sometimes there's physical or emotional outbursts, and so that's a really big thing that we work through. We set up contingencies and things like that and teach emotional regulation. So it's really important that they learn effective ways to get their needs met that don't involve these problem behaviors. And so that's a big part of treatment. And we find that depression rates lower when their problem behavior is lower as well. So those two definitely go hand in hand. Another problem we run into sometimes is people with autism tend to have really black and white thinking, and this can be helpful sometimes, but when receiving criticism, sometimes this makes them feel like all or nothing, like, oh, you're giving me this negative feedback. That must mean I'm bad. That must mean that things are not okay. And so we try to teach gray areas and we try to teach that all of us have stuff to work on. All of us get feedback and make mistakes, and we're all trying to grow and better ourselves. It's not just them. So trying to work on that flexibility, the ability to see gray area, that not everything is all or nothing. So, on the flip side, there are traits of autism that help make them successful, and that is actually a really huge asset. So, for example, people with autism tend to have really specialized interests. They maybe get obsessed with a certain topic and they pour themselves into that. So, with these three examples here, you see Albert Einstein, Steve Jobs, Tim Burton. They had these special interests that they poured themselves into, and they were crazy successful because of it. So, there's a lot of examples when we look back on people with autism who, because of the way their brain worked and because they were willing to be outside the social norms, they didn't give in to peer pressure, things like that, they achieved a ton. And so, with those kinds of things in mind, like, we don't want to cure autism. Having autism is not a bad thing. There are some traits sometimes that go along with autism that can be a barrier. So we want to work on the things that lead to pain, but we want to amplify their strengths. We want to play up the great things about them that are going to help them be successful that maybe come from autism. So autism is not a bad thing, that, and we do not want to cure autism. So I want to make sure that piece is really clear. So let's talk about self-esteem. It is a pretty big issue with a lot of our clients. Some of the older clients that I've worked with said, like, why would anyone want to be in a relationship with me? My brain is broken, or I'm defective. I'm just the weird one. You know, I hear these negative comments that they're saying about themselves, and it's heartbreaking. So I want to talk about a couple of pieces of that. So sometimes we set our expectations too low for our loved ones with autism. We have in our head that they have a disability and that they can't achieve that. They're always going to live with me, or they're never going to be able to do that, or I've always done that for them, so why stop now? So, in some ways, we're hurting their self esteem by doing too much for them, by not expecting them to do more, not pushing them outside of their comfort zone and telling them, you know what, you could get your driver's license, you could do that, you could get a job. You know, so that's a piece that all of us need to work on when we're working with someone with autism, not to hold them back, not to set our standards too low. The other side of things is setting realistic expectations. So, for example, one of my clients has a crush on a girl who looks like a supermodel, and she is, you know, she graduated college and she's living on her own and she's doing really great and she's in a serious relationship. So my client is not going to date her. She's not interested in him. And so we want to help him set his standards appropriately so he will pursue someone that would date him. And so right now he's feeling bad, he's feeling rejected, not understanding why his efforts to pursue this girl aren't working. And so we need to find a balance in that where we aren't holding our clients back or our loved ones back with our expectations, but yet at the same time, we're not setting them up for failure by telling them, yeah, go, you know, pursue that supermodel or whatever. So Another thing that happens in the autistic brain when they do autopsies, they see that the amygdala is actually larger in people with autism compared to neurotypical people. And so, if your amygdala is larger, that actually makes it more active. Some people call the amygdala our guard dog, so it controls our fight or flight response. And so, another thing you see when you're looking at the autistic brain, there's less connectors between the prefrontal cortex and the amygdala and the hippocampus. So, hippocampus stores memories, amygdala is the fight or flight response, and then the prefrontal cortex is where we make decisions, our logic, our reasoning. So, what's going to happen sometimes is the amygdala is going to flare up and it's going to be like fear, 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 protect yourself. But it's not communicating to your prefrontal cortex why. So sometimes people with autism are going to respond to that and have this fear response, but not process why they're having it. So through treatment, we can work on that. We can build those connections in the brain. The hippocampus stores memories, and so people with autism tend to have great memories, and sometimes that hurts them in that if something painful happens, they store that memory and it activates the amygdala to protect them. And so if we don't push through those fears, the amygdala is going to tell them to isolate. And so we don't want that. We want them to know that they can work through their fears and that they can overcome these things. So, processing these things with them so that they don't make this rule governed behavior to protect, to shut down, to isolate is really important because fear can prevent you from being successful. It can prevent you from achieving a lot of things. And so we really want to help our clients or our loved ones work through that so that fear isn't holding them back. So the next thing I want to look at is the chemicals that cause depression. Okay, so our behaviors create chemicals in our body. And if these chemicals are too low, then we start to feel depressed. We start to feel unmotivated. So dopamine is one of those main chemicals that give us that motivation. So there's healthy things that we can do to create dopamine, and then there's unhealthy things that we can do to create dopamine. So on the slide, you can see the list. Exercise and sex produce dopamine, healthy relationships, doing things that line up with your values, eating sweet and salty foods, pain, and then drugs and alcohol. So, what we want to do if somebody is struggling with depression is get them into a daily routine of doing the healthy things on that list. Exercise, spending time with loved ones, doing things that line up with their values. If we get them in a routine of that, their dopamine levels are going to go up and stay stable. What happens when we don't do those things enough, or if we just do the unhealthy ones, for example, like say you're an emotional eater and you eat a bowl of ice cream, what's going to happen to you chemically is your dopamine level is going to spike up and then it's going to crash down. And so, what's going to happen when it crashes down is you're going to feel sad, you're going to feel unmotivated, and your body's going to naturally crave more dopamine. So, what people do sometimes is then eat more, or maybe they drink alcohol. Maybe you know someone who's like cut themselves. That can happen because of low levels of dopamine. Your body is unconsciously craving dopamine and motivating you to do these behaviors that give you dopamine. But if we're not intentional about choosing the healthy things that produce dopamine, we can get ourselves into some pretty dysfunctional patterns. So, treatment for people with an autism diagnosis or not is getting that regular routine of these healthy things that produce dopamine. So, Temple Grandin is a famous person who has autism and she has her PhD. She does public speaking. She's really inspirational. And she talks about how grateful she is for her mother who is willing to push her. So she talked about in this book, The Loving Push, about how when she was younger, she didn't want to leave the house at all. And she wouldn't go to the grocery store, and like to the point that she would have panic attacks. And she said her mom recognized, like, this is really going to hold her back. If my daughter can't go to the grocery store, she's not going to be able to do a lot of things. So she lovingly pushed Temple and said, no, I see that you're having a panic attack, but we're going to keep working through this, and we're going to get you to the point where you're comfortable at the grocery store. So this is important. This is really a big part of treatment, that we're going to work through these fears. We're going to learn that our fears were not as big as we thought they were. This is critical for meeting goals. So let's talk about effective treatment. These things are research-based, that they're effective, and these are things that you could implement today. So there's a lot of research that supports that the autistic brain is very visual. A lot of people say that it's common that they see things in pictures rather than thinking thoughts with words. So that might not be true for everybody with autism, but it seems to be true with a lot of people. So we look for ways to create visuals to help people get on track. Self-assessment and reflection is really important, because it's hard to change something if you're not aware of it. Black and white rules, use that to your advantage. This tends to be how the autistic brain works. It's thinking in black and white. And there is a lot of things in life that we can say, black and white, never punch someone in the face, don't murder people. So the more things we can make black and white, the easier it is. Lots of opportunity for practicing, modeling, discussion, problem solving, things like that is super important. So problem solving is so critical. So what a lot of people do that really care about somebody who's struggling is they do it for them. This hurts them. You are stealing the opportunity for this person to learn that skill and for the person to develop problem solving skills. If we never struggle, we will not learn how to problem solve. So we need to be there for support, but we can't do it for them. We need to give them the space to struggle through it a little bit so they can develop those skills. So next we need to have negative and positive examples. Tell them what you should do, tell them what you shouldn't do. And the last thing is have fun, connect, treat them as their age. Sometimes when someone has a disability, people talk down to them and they talk to them like they're younger. And so this is really going to hold them back, and it's kind of disrespectful. So when we're working with our clients, we're trying to have fun. We're trying to relate to them and connect with them so that they feel respected, and they don't feel like we think we're better or we're talking down to them, that type of thing. So here's an example of some visuals. So here we have the first image is just pictures of like what good listening looks like and what bad listening looks like. The second visual is to help people who struggle with, so what happens a lot of times is you start to make progress and then you regress. Like progress is not linear. Growth is not just a straight path. Like there's going to be ups and downs. And so a lot of times when people experience the downs, they give up because they feel discouraged. They're like, oh, I'm not making progress after all. And so this visual is to provide hope. Like, it's okay if you struggle. It's okay if there's regression. Just keep moving forward. So here's an example from the Awkward book, Awkward, the Social Do's and Don'ts of Being a Young Adult, on how we're doing self-assessment. So we go through and we break skills down and we have them self-reflect. There's a lot of research that supports if you take data and if you self-reflect, you're more likely to meet your goals. So there's a lot of different ways we can get clients to do that, but you need to do this on a regular basis in order to really make progress and increase your self-awareness. Sometimes we don't realize the consequences of our actions or how we're hurting relationships. So this is a great way to take that time to do that. So our actions are leading us towards what we want. So next, teaching about gray areas. So as much as we want everything to be black and white, it isn't. So perspective taking activities are really important. Sometimes we analyze real life situations that just happened, like, hey, that just happened. How do you think the other person felt? What are some responses they maybe could have given you? Or what do you think they were thinking on the inside? To increase that awareness. We do role playing. We sometimes talk about things proactively, like, hey, you're getting together with some friends tonight. What do you think you would do that would help it go well? What would hurt it? This is a gray area. What are the possible outcomes? And then also teaching how to compensate for mistakes. All of us have said things that didn't really help us, that hurt us, our relationships. And so you need to learn how to compensate, how to make up for that. And so that's a big part of what we teach too. So here's an example of how we would provide negative and positive examples. So joking is one of those gray areas where humor is awesome. It diffuses so many situations, but if humor used at the wrong time or to the wrong person could get you in a lot of trouble. So for this example, we have them pick two people from different parts of their life. So maybe their mom and their boss. And then we have them list examples of, like, what could you joke about with that person and why? Like, why is that funny to them? Why is that okay? And then what could you not joke about? Like, if you told your mom, like, Thanksgiving dinner sucked, maybe that's not a funny joke to her. Maybe that would hurt her feelings because she puts so much effort into making Thanksgiving special. So talking through those things, this would hurt, this would not, here's why. So next, opportunities for modeling and discussion. This is where, like, we don't ask our clients to do anything we wouldn't do ourselves. So if we're saying, hey, you should work out, we're willing to work out with them. Hey, you should volunteer, we're going to be right there alongside them. Sometimes we do health challenges and we all try to lose weight together or eat healthier or whatever. So this is a partnership, and we want to be in it together, because it can be kind of demeaning if you're like, hey, you need to work on this, but not me. And so we want them to see too, like, these are things that I need for my life too. We're all working on things. We're all trying to better ourselves. And so having that model can be helpful sometimes, because then you can see how another person does it and you can learn from watching. So again, with problem solving, this is really important not to rescue. Don't do it for them. When like, I'm guilty of this, where there's a 20 something year old client struggling to zip his coat. And I wanted to go and zip his coat for him, but he's 20. And that's kind of embarrassing for a 20 something year old to have this girl therapist come over and zip his coat for him. I need to let him struggle through that so he can learn how to zip his coat himself, so he doesn't need help. And if I always rescue him, he's not going to learn that skill. So we need to be tough about not intervening, even though they might be struggling. Be there to support, be there to train, but don't do it for them. So next, I need to talk about reinforcing the good things. So behavior analytic research goes back really far, and it shows that if behaviors don't get reinforced, they go away. So what we've seen play out with some of our clients is they'll do a new skill, like cooking, for example. Maybe they cook, but then their family says to them, you added too much salt. This is too runny. This doesn't taste good. So then the client feels defeated, and they maybe won't want to cook for their family anymore because they got all this negative criticism in response. So it's really important that we're intentional about, hey, you did a new skill, you tried, you put yourself out there, great job. We need to reinforce behaviors that we want to see more of. The other thing is a term called differential reinforcement. So something that I can be guilty of too is reinforcing things I shouldn't. So this picture here illustrates, like, when somebody's behaving well, making good choices, we need to be fun, we need to be engaging, we need to pour on the praise and just make it a really good experience. But if that person crosses the line and starts having problem behavior, say they shout at you or cuss you out, turn off the fun, be stern, be clear. A lot of times people with autism miss social cues. So just giving them a funny look, but doing it anyway, or, things like that isn't going to be very effective. So we want that contrast to be really clear that you're behaving well. Awesome. Here's all the praise. Here's all the affection. Hey, you crossed the line there. The affection's done. The fun's done. Until you start making good choices again, I'm going to be stern. So here's another example of black and white rules. One thing we like to do is categorize behaviors as moving towards your values or moving away from your values. So, and just having that self-reflection of, hey, is the choice I'm making right now helping me or hurting me? That can kind of make behaviors a little more black and white. This other image here is an example of just a black and white list of do this, don't do that, just to help make things be a little more clear. So progress for each client is going to be individualized. And so, like I was saying earlier, progress goes up and down. So don't be discouraged if it's not a straight line. That's to be expected and normal. So each client is going to progress at different rates. And, it's really important that we include the client and their family in goal setting. Because if we're setting goals for people that they don't even care about, we're wasting our time. It needs to be about them and what they care about. That's what's going to fight depression. If we create a life that's meaningful to them, not to us. So we really need to tailor that around them. So one thing to recognize is that, say a client just really loves video games, they just want to play video games all day. So sometimes we need to connect other behaviors to their values. If they want to play video games all day, well, then they need to be pretty independent. They need to, there might be these other behaviors that they need to do in order to achieve that. And so if we can figure out what they care about, then we can help them see how these other non-preferred behaviors actually help them get what they want. So that's an important piece of treatment. And that's going to help them fight depression as well, because sometimes people are unwilling to do things and it's sabotaging their goals, and they don't realize how they're sabotaging their own goals. And so then they just feel depressed. So this is an important part of treatment too. So to conclude, depression is treatable. A lot of times skill development is a big part of it. Autism doesn't need a cure. It's an amazing thing. It can help them succeed. So we just need to target the things that lead to pain. So have high expectations, have fun, connect, follow through, be clear. This image on the side of the screen is behavioral cusp. So a question people ask is like, I don't know where to start. Like what skill should I start with? So a question to ask yourself is, what skill is going to open up the most opportunities? Behavioral cusp is a behavior that opens up a wide variety of reinforcement, access to things that they wouldn't previously have access to. So identify what's causing the most pain, what is going to lead to the most happiness, and start there. So that is all we have for today. Thank you so much for listening. I hope this was helpful.